Ashley, and I'll be sharing with you today my field of study, which will be a pediatric nurse. The background of a pediatric nurse is a pediatric nurse is a registered nurse, RN, and they're out of one of many healthcare providers. They specialize in treating children from infancy to late teens. Pediatric nurses can be found working in facilities such as doctors' offices, clinics, surgical centers, hospitals, and other facilities that provide health care. On the job, they do a number of tasks, which include taking blood and urine samples, performing physical examinations, ordering diagnostic tests, and measuring vitals. To become this specific type of nurse, usually a 4-year Bachelor of Science and Nursing degrees, BSNs, is needed. The salary is great. According to the Bureau of Labor of Statistics, also known as BLS, as of May 2019, the median annual salary for RNs was $73,000. Now, money may be a major factor, but going into this career is for someone who has the dedication, passion, and patience to work with children. Here is my degree plan for a 2-year pre-nursing. Now, the social importance will be that a pediatric nurse makes a great difference within society because without them, children wouldn't be properly cared for. When doing the job, it comes with not only engaging with the child, but as well as the parents. There's a certain way to talk and engage with the child and parent, mainly because of the age difference. Younger children may not be aware of the situation and may feel uncomfortable, but it's the nurse's job to make them feel safe. With the parents, they may feel worried. It's also the nurse's job to calm their nerves and let them know that their child is in good hands. Now, the cultural importance is that it's important to consider the patient's culture in this career field because some cultures have different way of doing things. Being aware of patient's traditions, ethnicity, and customs is a skill needed in order to properly handle the patient when in this position. Some medications vary with different ethnic groups, and if there's a patient who speaks Spanish, providing them with a translator would be the best route. Making the patient and parent feel comfortable is a key role. Not only does it affect them, but also the provider. Now we have the political importance. Being a pediatric nurse means there will be individual responsibilities. Responsibilities such as informing parents on ways to keep their child healthy and how to provide general care to their child, as well as the PRN providing care to the child, their self, and making the parent comfortable that their child is in the right hands. There are multiple jobs in this career, and I found 5. One being a pediatric operating room registered nurse, which is located in Houston. Then we have a pediatric nurse, which is also located in Houston, a pediatric home health nurse, a travel nurse RN pediatric, and a pediatric clinic registered nurse, which are all located in Houston or in Sugar Land. Then we have internships. I found 3, and then we have scholarships. I found here 2, and the links for each of them. And why I choose this career. I thought long and hard about what I wanted to do in life, and being a pediatric nurse has always interested me the most. People ask me, why kids? They can be annoying and hard to manage. My answer will always be, although they can be difficult, it's always nice to see the smiles on their faces while bonding with them and then reassuring them when they're afraid. Also, my goal is to provide hope, care, and relieving the concerns parents may have so that they may not be as worried. I know the medical field is a difficult career, and I have my fears. However, I'm committed to achieving my goal on becoming a pediatric nurse. And that will be all for me today. Thank you.